Hello everyone. Today's video is about the successful treatment of a case of small intestine bacterial overgrowth, also known as SIBO. As per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only, and if you need medical advice, please talk to your healthcare provider to get that advice. So I've been doing a little video series just talking about the successful treatment of a range of different conditions. I've done videos now on chronic Lyme, on mold toxicity, on histamine issues like mast cell activation syndrome, heavy metals, and POTS, which is postural orthostatic tachycardia syndrome. It's a form of dysautonomia. So I'm rounding the bend here. I figured I'd do a talk or do a video on SIBO. And the reason that I'm doing these successful treatment videos is because someone had posted a comment on one of my other videos saying, essentially, could you please post some videos about successful outcomes, because a lot of us are in the throes of these different chronic or difficult illnesses, and it would be nice to have some ray of hope that, like, hearing about people who are getting better. So I thought that was a great idea, and hence me doing this little video series. So have to talk about SIBO. It's just something I've seen so much of in my practice. I did a tally a few years ago, and at that point I treated over 2,000 folks directly, like myself, with SIBO, and then I've had several resident naturopathic doctor residents over the past few years, and many of them have treated patients with SIBO, and I consult on all of their cases. So just by proxy, I've had a lot of exposure to SIBO cases over the years. What was kind of interesting, to me anyways, as I was thinking about, which case should I talk about, is that with so many of my cases with SIBO, really a vast majority, we don't wind up doing follow-up testing, like a follow-up lactulose breath test, which by many is considered to be the gold standard clinical test for SIBO. If with many patients, we don't do a follow-up test after their symptoms are gone, because, and I don't blame them, a lot of people do not want to pay for that follow-up test. Here in Canada, where I'm located, we don't have insurance plans. By and large, there's rare exceptions where folks get private insurance through their workplaces sometimes. Every once in a while, there's a plan that will cover lab testing, but for the most part, vast majority of cases, patients have to pay for the lab testing out of pocket. Our socialized healthcare system does not cover functional medicine labs, shall we say, like lactulose breath testing. I think they should cover it, but they do not. A lot of patients, again, justifiably so, don't wind up doing follow-up testing. So if a patient, comes in, tests positive for SIBO, we implement the treatment, they get to the point where they have no symptoms left, they come off their treatment and they're still symptom-free, then yes, ideally we would do a follow-up test just to make sure there's no SIBO left. But quite frankly, even if there was a bit of SIBO left and the patient's symptom-free, we really don't have any studies telling us definitively if that's a bad thing. If you're asymptomatic, you just have maybe a little more bacterial overgrowth than the average bear, maybe that's okay. In any event, I was trying to think of cases where they actually did follow-up testing, and I have had several over the years, but so anyways, I settled on one, so this is that case. So this patient, I started working with maybe 4 or 5 years ago. It was definitely in the pre-COVID days, so I guess at least 3 to 4 years ago. And she had, classic symptoms associated with SIBO, so a lot of bloating, abdominal pain associated with that bloating. Didn't really have any constipation or diarrhea issues per se. Like bowel movements were pretty normal, but just a lot of discomfort. She had some eczema as well, which was kind of a secondary concern, but just oftentimes, not always by any stretch, but oftentimes we'll see different skin issues associated with SIBO. So I took her history, and she didn't have any really eventful history. Like, it wasn't like, oh, I had food poisoning and then I developed all these symptoms, or I went on a fateful course of antibiotics and I developed these symptoms. But she just said, they just kind of gradually started getting worse. She was fairly young, like I think she was in maybe 21, 22 or something like that. She started getting some symptoms in her late teens, and they just kind of progressively got a bit worse, and they'd been quite bothersome for a couple of years, like at the current level of intensity. So, we discussed different options, and I said, well, I think you may have small intestinal bacterial overgrowth. Could be some other things. Could be LIBO. Could be this or that. But we decided to move forward with a lactulose breath test. So she did the test, came back quite notably elevated for hydrogen gas producing SIBO, kind of in the 40 to 60 parts per million range. So not, astronomically high SIBO, but definitely not, just barely positive SIBOs, kind of moderate-ish SIBO. So Based on those test results, I recommended that she go on some enteric-coated oregano essential oil capsules and some berberine, and then also work with an anti-SIBO diet. And there are several different methods out there that are used diet-wise to help manage SIBO. At the end of the day, we want to kill off the microbes with the antimicrobials, whether that's oregano essential oil, whether that's a pharmaceutical drug like rifaximin, whether it's something like berberine, whether it's something like neem. There's different options. Then we also want to starve out the bacteria as well. And so there's different diets that can be used. Some people recommend a low FODMAPs diet. Some people recommend a GAPS diet. Some people recommend an autoimmune paleo diet. Some people recommend a carnivore diet. There are various options out there, but for most of my patients, I recommend sort of a hodgepodge of a quasi paleo diet. Generally, they're restricting, not with 100% strictness, because I find really challenging for folks to be 100% strict with diets, although there are patients out there who seem to need to be, and some who prefer to do that. But I usually recommend trying to stick with dietary recommendations around 80% compliance. There are exceptions to that, but for SIBO, I find that's usually pretty much all that's required. That being said, if a patient tells me like, oh, every time I eat corn, like, man, I just feel awful, it's like, well, you should probably avoid corn like the plague, because that's really just not good for you. But if it's not causing like really obvious symptoms, then I think having a little bit of wiggle room makes life a lot easier. And again, I don't really notice a big difference with the folks who are 80% compliant versus 100% compliant. Anyways, I digress. So I recommended an anti-SIBO diet, and which is essentially a diet that was very low in grains, low in complex, low in starches rather, is another form of complex carbohydrates. Low in potatoes, sweet potatoes and corn, low in refined sugar, and then also, even though it's not kind of a strict SIBO thing, I usually recommend trying to minimize dairy as much as possible, because I find just a lot of folks are sensitive to dairy. So I recommended the diet, the enteric-coated oregano and the berberine. Asked her to follow up again in about 4 weeks. I virtually always ask my patients to gradually increase their dosage of herbs or other antimicrobials that we're working with, just because I don't want them to have a die-off reaction or Herxheimer reaction. So we followed up after 4 weeks, and she was doing quite a lot better. She was really happy. Her bloating was down from I think it was around 7 or 8 out of 10 at baseline. If 10 is bad, it was down to about a 3 out of 10, so quite a lot better. She wasn't really having much abdominal pain. Her skin was doing a bit better with the eczema. Not that that was a primary concern, but it was a bit better. So we say, hey, let's take it. And so she was feeling better. So I said, well, you probably need a bit more time on the protocol. So, please, continue with the protocol. She was tolerating it well. She was doing okay with the diet. Like, it was, a little bit of a pain in the neck, but she wasn't having too much trouble managing that. And then I also recommended, though, in addition to continuing with the protocol, I asked her if she would do a stomach acid challenge test. I've posted videos about this before, but it's essentially an at-home test where a person takes a stomach acid capsule, see if they get heartburn or not, and then depending on the result, then that gives us some clinical insight into whether they might have low stomach acid or not. Low stomach acid seems to be an appreciable risk factor for the development of SIBO. And so I was thinking, well, she didn't have that obvious trigger of like, oh, it was food poisoning induced, or it was antibiotic induced, or something like that. So I thought, well, maybe it was just a true blue, like, yeah, she just was eating foods that are SIBO friendly, and they just gradually started to overgrow. But she was fairly busy. She little bit of trouble making ends meet. She's working a fair bit and all of that. So I thought, well, there's the stress component. Maybe she's got some lower stomach acid. So she came back after another month or so. She was doing a lot better. Her bloating was just down to like virtually nothing, unless so down to like a 0 or a 1 out of 10, unless she was eating foods that were triggers for her. So again, with that, the one advantage of that 80% compliance, give or take, with the diet is that as a person's going along, like, hey, I'm feeling a lot better. I went out with friends, I had pizza. Oh man, I bloated out to here. Well, you kind of get some real-time feedback about which foods are problematic and which are not. So she found that dairy was definitely a problem for her. She found that gluten was a trigger for her as well. She found her skin was a bit worse with sugar, but otherwise didn't really seem to bother her digestive health a whole lot. So at that point, I said, well, you can probably start weaning off of the antimicrobials. You can start phasing foods back in a certain way, like kind of reintroducing one food at a time, like every few days. And I said, just for good measure, we could retest and see if you still have SIBO or not. And I was expecting her to say, no, it's good, because that's what almost everybody says. But she's like, no, I want to retest. Like, this was such a thorn in my side. I really want to make sure those critters are down to, a normal level. So we redid the SIBO test, and like the lactulose breath test, and lo and behold, the levels were down to normal. So she was between the 40 to 60 parts per million range, and she was down in the single digits or the mid-teens range, which you ideally want the parts per million of hydrogen gas to be 20 parts per million, or less than 20 parts per million, so 19 or less. So her SIBO test was normalized. She was feeling a lot better. Despite the fact that her SIBO test came back looking fine, I did recommend that she gradually taper off of her antimicrobials instead of stopping them cold turkey. I find that's just a more prudent approach to take, and I've just had too many patients where they're feeling good, they stop everything cold turkey, and then they have a relapse of symptoms. And it's not that we're starting back at square one, but figure like, it's just better to taper off, and why put yourself through a big symptom relapse if you don't have to. So she tapered off her protocol. We followed up again a couple of months later. She did have low stomach acid, her response to that stomach acid challenge test suggested that she had low stomach acid. It's not a 100% definitive test, so I like to try to be mindful with my language there. That as best I could tell from her response to that test, she likely had low stomach acid. So she started on a stomach acid supplement. She found that by bringing that into the mix, and whether it was just passage of time as her gut was kind of healing up more, being no longer affected by SIBO, or maybe it was related to the stomach acid, but for one reason or another, she found that she could tolerate the gluten and the dairy a bit better over time. And so we followed up again a couple months later. She had no problem weaning off the herbs, was had reintroduced various foods, and it really seemed to be the dairy primarily, gluten somewhat, that were the biggest triggers for her. She found that the stomach acid supplement, she gradually didn't need it anymore. As she was taking it, she found that she had to keep lowering her dose because it was gradually causing heartburn for her, which is typically, in my experience, an indication that a person doesn't need as much of stomach acid. Eventually she didn't need any anymore. And then I think we had a follow-up visit maybe like 3 to 5 months later or something like that, just to check in, just really quick phone appointment. And she was doing well, had not relapsed. She just found like, she tries to stay away from the gluten. I think at that point actually she was eating, so she was really still avoiding dairy quite a bit. She was actually eating quite a bit of gluten, and I just said, hey, if you can get away with it, that's great, but just keep an eye on your skin, because that can be a barometer for if there's too much gluten going down the hatch. And then also, of course, keep an eye on your gut health, and if you start noticing some symptoms creeping back up again, just first line approach would be like, just what's been going on diet-wise. Maybe I need to kind of pull it back a little bit more, maybe not go all the way back to that modified paleo diet, but be a little more mindful with the gluten and greens and things like that. If that's not doing the trick, give me a call and we can talk about getting you back on an antimicrobial regimen again. So that is the end of that story. So I hope that this case was of interest. If anybody has any comments or questions about this topic or anything else, please post in the comment section below. And I think this is the last successful case video episode of this little series. So I've been remiss. I've not really been looking at comments lately, but I'm going to go look through those. If anybody does have any requests for other successful treatment categories, like other videos you want me to post, I'm happy to do that. So I'll take a quick look, but otherwise I'll get back to posting the regular Q&A videos, and we'll go from there.